Hey y'all, this is your inspirational nurse coming to life with another great video. Let's talk about how to give and receive a bedside shift report less than 5 minutes like a pro. So in this video, I'm going to give you the tea. I'm going to educate. I'm going to tip you on how to do it very fast and efficient so that your patient has a better outcome, a better survival rate, because let me tell y'all, bedside shift report is key now, y'all. These patients are sick. They are not the patients I had like 10 years ago when I started out in nursing, when comorbidities wasn't like 2 pages long, y'all. These patients are very, very sickly and they turn on you so fast, so you have to stay on top of your feet. But I feel like if you have a good start in your bedside shift report and you have a strong foundation on the type of patients, asking the right type of questions for the type of specialty that you are currently in, even if you're a traveler, I'm going to tell you exactly what to do. So keep watching. So for those that don't know, I am your former LPN, medical assistant, volunteer, RN, BSN, worked my way up, been in management several times. And one thing I can say is that bedside shift report was a very strong foundation as part of my training when I first started as an RN. We was definitely held accountable and it was audited a lot. And it was something that you got to practice over time. You'll get better. But as a traveler, you have to learn how to adapt to different types of units and specialties. So I'm going to tell you also things to do, because as y'all know, I am a traveler and I've been one for a very long time now. And currently I am on a night time contract right now, so, and it's getting ready to end soon, and I already have my next contract for my new location. I recently relocated, so I've just been going through a lot, y'all. So I've been hearing a lot of nurses complain about their reports that they're getting. They finding out that their patients have more than just what the nurses are saying. Also, you have resource pool nurses now for those who work in resource pool, and sometimes a lot of times those nurses are just put on random units and they really do not know the team as well as the patients, and so they constantly have to relearn those units, relearn the patient, and really dive deep into that unit. And then maybe they are taking out that unit and then put somewhere else. So I also tried resource pool and it was kind of like a hit and miss for me, for those who are resource pool nurses. So let's jump right into bedside shift report. So when you are asking questions about bedside shift report, you want to keep in mind the type of patient you are taking care of and the type of unit. This would definitely key you to make sure that you are asking specific questions and you don't have to ask every little single thing. Now, I'm going to give you the rundown on some of the things that I do to make sure that every time I have a successful bedside report, whether I'm giving it at the end of the shift or receiving it from the next shift, I'm going to tell you exactly what to do. The first tip I'm going to tell you is that if you're in a critical care area or some type of high specialty area, cardiac or something like that, you want to make sure that you are asking that team, do they have a specific bedside shift report paper? Now, most of the time I found that most units do have a specialized report sheet that just customized to the type of patient that they are caring for. Now, sometimes it's helpful to take a look at it, even if you already have like a piece of paper where you write random things down on, as you already know. This will key you on things that you might miss when you are doing your bedside shift report. So some of the highlights during your bedside shift report would be asking about electrolytes. Have you replenished any electrolytes for the patient? If so, did you put the labs back in to see if they improve or have they got worse? So we are tracking and if there's a pattern or a trend to if the potassium got better or sodium levels are getting better. Is the patient, following their care plan? Are they being, their outcomes, are they having better outcomes, right? Or if they're going opposite direction. So even though you're replenishing electrolytes, is what we're doing effective? So you always want to evaluate your interventions. As a nighttime nurse, you are going to be following behind and working behind many nurses. And I already tell my nurses, I do not play when it comes to a bedside shift report, and I don't play when it comes to the patient's life. So when it's time for the get report, they are very in tune with me. They always ask me, do I have any more questions, which is really great. But it's good to, like, when you come on to night shift, another great question would be, have the patient been coded within the past 48 hours. Now, a lot of these things that I'm telling you is not going to be listed when it comes to the summary on Epic, when the hospital teaches you as your new nurse to go ahead and use that. It is missing key information. So it's important to start practicing, right, with friends. Maybe you have friends on the unit where you want to practice your bedside shift report with. You want to make sure you stay professional, and I always introduce myself to everyone in the room, and I ask the relationship of who's who in the room and who's the POA. And then I also set my expectations for the shift. Well, during the shift, I will be evaluating whether whatever the electrolytes was replaced, or whatever blood transfusion was given, or whatever drips is running, I'm evaluating whether those interventions was effective, right? Because night shift is a totally different beast, y'all. And the difference is on nights, you have to be a strong nurse because, as y'all know, the resources are limited. We don't have the doctors right by us. So you have to be on top of your stuff. So I always would tell you to key yourself to check the charts as the nurse is talking. Do not just do bedside report with a paper in your hand and she has a paper in her hand and that is it. You want to check the chart against what the nurse is saying. So if the nurse is saying, yes, the patient is on BiPAP, you want to check the chart, check the orders to make sure the BiPAP orders are still current. And that, yes, the patient, it's been documented that the patient is on BiPAP or whatever type of oxygen therapy. These are the things that you want to check behind. Now, when it comes to your lines and drains, you want to make sure you are checking. So the first 5 seconds coming into the room, you are going to surveillance with your own 2 eyes. And basically what you're doing is you're going to look around the room. Within that 3 seconds of looking around the room, you're basically looking into pump to see what it's infusing. You're basically looking to see if there's anything out of place in the room, right? So maybe something might be out of place to make sure the patient is still alive and not dead, because I saw some things in healthcare, y'all. I saw a whole patient get transferred to a nurse that was dead, a whole dead patient. And the nurse couldn't believe it. She kept saying, what are you talking about? And when we looked, the transport was bringing a patient from the ER that was dead. The patient was literally cold and like done, like no breath, looked like they'd been down for a while, and was trying to transfer it to another nurse. So when I tell you I have seen and experienced things in nursing that a lot of nurses, especially like me, senior nurse, is not going to tell you to prepare you, especially new nurses coming in that are still learning your steps, right? Your checking. I feel like new nurses are good to have on the unit because you guys are fresh out of nursing school. Y'all got the energy. Y'all remember every little step. But as for a senior nurse, we are more quickly to pick up things because our brain can feel when something is wrong, right, with the patient. Automatically, we can come into the room and know that there's something wrong with the patient or something is happening, right? So you want to ask also, in the last 48 hours, have the patient been coded by the RRT team? And if so, what led up to the code? This is super important because if the patient has been coded 2 times and now you're taking over, this is something that you would miss if you have never asked. Also, I always ask is all the documentation has been done. So while the nurse is saying, well, yeah, I think I did. I'm like, did you do your skin assessment when they returned from surgery? Did you look at your staples? I always count every staple, especially when they have staples, not skin glue, none of that. I make sure I'm counting to make sure nothing is dehisting, especially if they're a surgical patient you're taking over. I've seen wounds that actually dehist. Making sure that it doesn't break through the dressing, right? Make sure that patient is not bleeding profusely. I caught a DIC before as a new nurse. Yes, God has been using this brain, y'all. So I can tell y'all some key things when it comes to bedside. First thing also you want to be checking, like I said, is your lines and your drains. The patient has ostomy, G-tube, PEG tube, surgical drains, wound vac, drips running. You want to make sure that as the nurse is talking, is what you're saying is presented in front of you. Basically, is the patient has these things going on, right? I always encourage the patient to add to the bedside shift report to let me know if there's anything special they would like for me to know to better care for them tonight. What that does is it gives the patient a chance to be in control of their care and is encouraging them to participate in their care. And I always test them on their diagnosis and why they came in the first place, their medications, and maybe some key things of their vital signs. You always want to check your baseline. That's the first thing you're checking when you're coming onto the computer. You're checking your first blood pressure. What was the patient when they first got here? Do they run soft? Are they low? Were they already low? Is this patient on a sepsis timer? Because the patient might come in with a certain diagnosis. Look at your diagnosis and think about the complications behind the diagnosis. Maybe your patient came in as an automental status, right? So now, is this patient going to be getting neuro checks? Make sure you check in the orders against what the nurse is saying. And then say, hey, did you do all your assessments? Was you able to complete all your tasks? Is there any tasks or assessments that I need to follow up with or complete? Because nursing is 24 hours, y'all. So, you know, at some point we have to go home and pass the ball to the next team, right? So you have to be able to just take on whatever wasn't done. But certain things, I make sure the nurses finish before they leave. I said, well, can you page the doctor to make sure the restraint orders were renewed? That is another thing. Asking about restraints. If your patient is on restraints, the first thing you should be doing is checking to make sure they're not too tight. Make sure you check the tie, that is tied properly. I have seen techs and CNA struggle with tying restraints, and next thing you know, the lines are all pulled out by the patient because the restraints were loose. Also, I check behind the nurse documentation to make sure that she's doing it every 2 hours. And a good way to remember your documentation for restraints is to do it every even hour. So every even number, you will do your documentation. That will cue you on, okay, every even number, I'm going to do my restraints documentation. Also, you want to check to make sure that you are doing your least interventions. Maybe take the restraints off to give the patient time to have a break. And also, you want to check your orders to make sure that it's not expired and you don't have restraints. You have restraints on a patient that has expired orders. You do not want that. If the nurse did not have time, make sure before they go home that they go ahead and they reach out to the provider to get the orders renewed. Also, you want to assess the patient. You want to make sure that thoroughly you're checking the skin. That is important because anything new as a wound or any skin tear that you take on it, now you're taking responsibility for that skin tear or that wound. What you can do is check the chart to see if the wound care nurse or wound team place pictures in the chart against what you're going to see on the patient when you're assessing the patient. And if it's dressed, you can remove the dressing somewhat to take a peek because you still want to assess the patient. You don't want to just say, oh, it's dressed, the dressing is there, it's intact. Okay, well, is the skin intact? That's all I'm saying. You know what I'm saying? Also, you want to make sure you are checking your IV lines. Maybe you are on the floor where you have 4 or 5 different lines running. Are those lines labeled? I remember coming on to a shift and this patient was running like 3-4 different things. Is things labeled properly, right? Is it going through the IV properly, right? The patient is receiving it, right? The IV is not infiltrated. You want to check your lines. You want to check your drains. If they have surgical drains, you want to check the color, the consistency of what is coming out of the patient. Making sure also if the patient urinated or had a bowel movement. That is so important. How many patients we have had that has been retaining urine, and they're not peeing 30 mLs an hour. If you go back into the chart and check, Epic will always total your urine for your shift. Also, you want to make sure you documenting your I's and O's. Make sure the nurses did all their I's and O's properly. And you are totaling out your volumes for your fluids and anything that you ran, like antibiotics, anything extra that you're running. Because this counts towards your I's and O's as well. So you want to make sure that you are checking behind the nurse so that way they can finish their documentation and their assessment. It's okay to say those things. I remember guys as a new nurse going to different floors and they hated my guts because I was doing the bedside shift report. These nurses were like, I'm not doing all that. I'm ready to go home. Blah, blah, blah. Meanwhile, but if the patient passes and died or something's going on with the patient, now you're in jail and you're like, damn, I should have took the 5 minutes to do the report. Now, the best advice I can tell you is right before your shift is over, the last 2 hours, you want to take your time and thoroughly go through the chart. Now, this is a good time to go look at labs, look at the notes, the provider last note. You should looking at the H&P note. You want to look at everything and then rewrite your bedside shift report for the next shift with the updates on what occurred during your shift. If there's any nurse concerns. Now, I added that new because sometimes nurses have concerns with maybe something they're very concerned about, but maybe the doctor is not really paying attention to. So I added that to my bedside shift report. I asked any nurse concerns for this patient. It could be anything. The nurse could say, yeah, this patient been bleeding profusely for the past 6 hours, blah, 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 blah. We paged your doctor, no response, or whatever the case may be. Also, you want to make sure that you are just talking to the patient as you're giving bedside shift report. It should be something as a conversation that is an open conversation with you're asking patients when a nurse gets stuck. Now, you might get nurses that that don't know nothing about the patient, because they would just sit there and look at you like you're crazy. I remember a nurse recently give me just 3 words. It was like, well, yeah, that's all I know. And literally about to lock the computer up and go. I said, where you going? Made them sign right back in, and we went through the chart together, and we went and go see the patient before the nurse went home. His excuse was, oh, I used to being in the ER and blah, 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 blah. I don't give that in the ER. First of all, you are on medical med-surg floor. This is not the ER. This is the expectations for the unit and for the patients. If they're on any time-sensitive medications, you can ask that during your bedside shift report. There's certain medications that you have to give on time, on the dot. There's certain medications that you need to make sure you're doing your handoff, your heparins, your blood transfusion. You may have TPN running. You may have certain drips running. You want to make sure that the handoff to the next shift and that the patient is tolerating this medication okay. Another thing also, you want to make sure that if the fluids are low, these bags are low for the medications, especially if you're in the ICU setting or step down, you're running several different drugs. You want to ask the nurse, hey, did you already order the next bag? Can you go ahead and order me the next bag? Or, hey, this is completely dry. Can you order the next